Hello and welcome back to my YouTube channel Veterinary Wizard. Hope so you all will be fine. So today we are going to tell you a very important disease of canines that causes more than 90% mortality in untreated dogs. But if dogs are treated with extensive supportive care, then survival rate is 85% to 90%. Yes, I am talking about canine parvovirus disease. Let's start our video. First of all, let me tell you, if you watch our complete video, what will you learn from this video? We will cover in this video first of all introduction of canine parvovirus infection. Then we will cover its incidence, and then step by step we will cover its etiology, transmission, pathogenesis, clinical signs, diagnosis, differential diagnosis, and at last treatment, control and prevention. So what is canine parvovirus infection? It is a highly contagious disease that affects mainly dogs. It has two forms. First is the intestinal form and second is the cardiac form. Intestinal form is characterized by vomiting, diarrhea, weight loss and anorexia or lack of appetite. While cardiac form affects heart muscles of very young puppies that leads to death. Let's move towards incidence of parvovirus infection. So canine parvovirus infection was first recognized in 1978. And this virus is about 98% similar to virus that causes feline panleukopenia in cats. But mostly puppies are affected of age 6 weeks to 6 months. There are also some breeds such as Rottweilers, Doberman Labradors, German Shepherd, and Alaskan Sled Dogs are more prone to the canine parvovirus infection. Before knowing anything else, one should about etiology of canine parvovirus infection. So what is the causative agent for this infection? The causative agent for this infection is a non-enveloped DNA virus known as canine parvovirus. It is small DNA virus having diameter of about 18 to 24 nanometers diameter. Parvovirus has two types: canine parvovirus 1 and canine parvovirus 2. Canine parvovirus 1 was present in earlier times, but nowadays canine parvovirus 2 is common in canines. One question that arises in mind is that how parvovirus is transmitted? Here is the answer. Parvovirus spread by both direct method and indirect method. Directly by contact with the infected dog and indirectly through oro-fecal route. When a healthy dog sniffs feces or excreta of an infected dog, the healthy dog get affected. If a puppy is not vaccinated, about 1,000 particles of this virus is enough for the parvo infection. If a puppy is infected from parvo infection, virus excretion starts from 2nd to 8th day. I hope so that now you know that how parvo is transmitted. If there is still any problem, let me show a picture that will help you to understand. So here in this picture there is a dog that is infected from parvovirus and he passes stool. And the healthy dog is sniffing that stool, through which the virus enters into healthy dog and then multiplies in intestines. Now let's move towards pathogenesis. First of all, the virus enters in the animal through oro-fecal route. After entering in the body, the virus start replicating at lymph nodes, spleen, and thymus. Then viremia takes place and virus migrate to lymphoid tissue. An animal leads to shock and heart failure, resulting death. Moving forward, next step is very important, and that is clinical signs and symptoms. As we have told you that parvovirus has two forms, so we will discuss their clinical signs separately. When we talk about clinical signs on the basis of enteric form, then you will see severe bloody and foul-smelling diarrhea. Animal will be lethargic and off feed, that is also known as anorexic. Animal will be dehydrated, hypothermic, and severe weight loss with vomiting will be seen. But if we discuss about the clinical signs that are associated with cardiac form, there may or may not be clinical signs. This form is confined to puppies of 2 to 8 weeks of age. Tachycardia or increased heart rate will be seen. And death may be sudden or may follow dyspnea. Okay, here in these pictures you can see the dogs having clinical signs of parvovirus infection. Next is the diagnosis. You can diagnose this condition with the help of clinical signs that I have discussed earlier. For confirmatory diagnosis you can go for animal inoculation test, isolation of virus, HA and ELISA. And you can also use commercial diagnostic kits. There are 3 types of kits available in market for parvo diagnosis. SNAP Parvo Antigen Test, Fastest Parvo Strip, and Witness Parvo Card. SNAP Parvo Antigen Test is based on enzyme-linked immunosorbent assay technology. The Fastest Parvo Strip is a lateral flow immunochromatographic test. And Witness Parvo Card is also based on radioimmunomigration technology. This picture shows positive parvo test in a puppy using a commercial diagnostic kit. Let's move to next part of this topic, that is differential diagnosis. In this video I have only enlisted the diseases that can be differentiated on basis of clinical signs. But if you want complete video on differential diagnosis, do mention in comments section, then I will make the video for you. We will differentiate on the basis of disease that causes enterithes and disease that causes myocarditis. The disease that causes enterithes and can be differentiated from parvovirus disease are canine distemper infectious, canine hepatitis, canine coronavirus, salmonellosis, campylobacteriosis, hemorrhagic gastroenteritis, and poisonings. But disease that causes myocarditis are canine distemper infectious, canine hepatitis, canine herpes virus, streptococcal infection, and congenital heart anomalies. So these are the diseases from which you can differentially diagnose the parvovirus infection. Here is the most important portion. That how can we treat the animal that is affected from parvovirus infection? There is no specific treatment of any viral disease. We will go towards the symptomatic treatment. But be prepared for 5 to 7 day hospital stay. Obviously intensive care is needed to treat this infection. First of all you have to go for fluid and electrolyte therapy. To maintain the salts and recover the dehydration. Use antibiotics, antacids, and antiemetic. If animal is severely anemic, then go for blood transfusion. Most importantly, use immunoglobulins and immune boosters. Last but not the least is the control and prevention. To control this disease you should have to follow strict hygienic measures. Separate the healthy and infected animals. And properly dispose the feces and disinfect the area. For prevention, follow the proper vaccination schedule of the puppy. And if slight symptoms appear, visit nearby veterinarian. So this was all about canine parvovirus infection. If you have learned something from this video, then like this video and subscribe our channel. And if you have any question, mention in comments section below. Thank you very much.